Hello, everybody. My name is Ceyhun Gasanov. I'm the representative of Lasatronics. We would like welcome to our extensive online training in laser dentistry with our international QAL for Lasatronics, Dr. Marwan. I really hope everybody will gain a good experience and knowledge in this training. So, Dr. Marwan, I would like to invite you to start the training.
Okay, hello everyone. Hope everyone is doing well. I'm your host, Marwan El-Mubadder, and I'm going to give you the third international educational training program that is organized by the Lasatronics company. So today it's going only to be an introduction of what we are going to see. And I would like you please to ask all of your questions if you have any comments, and to stop me whenever you want by just typing your comment and in the section here, and we will answer all of them for sure. So the topic is to discover the controversy in laser dentistry, because now there is many applications in dentistry using the laser. Not all of them are based on scientific evidence, and not all of them are correct. So it's very interesting to do a webinar, to do an educational program, and to try to differentiate between scientific use of laser and between the non-scientific use of the laser. This webinar will be divided into three. So first, in October 20, we're going to talk about the laser-assisted protocols in periodontology and implantology. So I'm going to divide this webinar into everything related to the classical use of the laser in periodontology, in the classical surgeries, crown lengthening, phenectomy, vestibular deepening, gingival and labial depigmentation. Everything will be based on scientific evidence. And then in October 27, we're going to talk about the truth and about the myth of the photobiomodulation, also known as low-level laser therapy. There's a lot of interesting protocols, and we're going to see them. And finally, I'm going to share with you all the clinical applications of the laser for the aesthetic dentistry and in our daily practice, and also a very special protocol in the aesthetic medicine. So facial aesthetic medicine, the dentist can, or for example, your dental hygienist can, for instance, with the SmartM laser, do special protocols in order to enhance the facial appearance of your patients, treatment of depigmentation, a treatment of acne. We're going to see all of them hopefully in November 3. So let me please introduce myself. For those of you who don't know me, I'm a dental surgeon. I finished my studies in 2016, and then I did my master's degree in Belgium at the University of Liège, and I did my postgraduate diploma in periodontology from the University of Strasbourg, and currently I'm a PhD candidate at Wrocław Medical University in Poland. So to start immediately with the things that are interesting for you, in October 20, we're going to talk about, and I'm going to share with you all the tips that I know and all the current evidence. So for example, in old cases, we used to do something that today we don't know, we don't do based on the new scientific evidence. I'm going to share with you all of this. I'm going to give you the summary or the conclusion of everything you need to know, the tips to have a successful treatment in crown lengthening, lip repositioning in order to manage the cummy smile, labial and gingival depigmentation, vestibular deepening, of course, when we want to preserve the keratinized tissue, or before any placement of a prosthetic appliance, phenectomy, gingival hyperplasia, operculectomy, hemostasis. So in any case and in any kind of surgery, you need sometimes to stop the bleeding. You can do it very easily with the laser. The laser-assisted periodontal treatment, and here I'm talking about properly the management of periodontitis and peri-implantitis. So with the smart laser, there's a lot of protocols, and actually this is one of the topics that I'm doing now in my PhD. We can use the 980 nanometer wavelength coupled with other disinfection solution, but also to have better disinfection. And for sure, I'm going to talk about this in details the next time. Now I'm just giving you a summary. You can use the special photosensitizer of the Lasotronics with the 635 nanometer wavelength. These can enhance very significantly the disinfection of the pocket, and then you can treat the patients with periodontitis, with severe periodontitis, without the need to do a surgical intervention. And finally, we're going to talk, as I've said, about the photoactivated disinfection and photodynamic therapy in periodontitis, but also in peri-implantitis. I would like to take this opportunity to mention that I've recently published a book about the non-surgical treatment of periodontitis using the laser, using the 980 nanometer wavelength laser, using the 635 nanometer wavelength. The book is available on Amazon. You can simply scan the QR code here, or you can type the name of the book on Amazon. In this book, as I've said, I will talk about all the current evidence, what is based on scientific evidence, using the laser in order to enhance the non-surgical treatment, so to avoid the surgical intervention. But also I've mentioned some of new approaches, such as using antimicrobial peptides and probiotics. And finally, at the end, I've shared with you some of the clinical cases. As I've said, we're going to see step by step and in details many indications of using the laser in periodontology. Some of them is, for example, gingival depigmentation and labial depigmentation. Here, everything will be based in this webinar on clinical cases that I've personally did. So in case it's a clinical case that wasn't done by me, I will tell you. If I don't say by default, then this clinical cases were done by me. And also it will be based on publications that we've published to prove that these protocols are the adequate protocols. So here, for example, the conclusion of this publication is that the 980 nanometer wavelength was the best wavelength in order to have a long-term stability, a long-term aesthetic results without reappearance of pigmentation. With wavelengths such as the CO2 laser and the erbium YAG, we had a reappearance of pigmentation. So this is an example of something we're going to talk about. And then I will share with you a new approach for the management of labial depigmentation. As I've noticed, this is very interesting in the Middle East. A lot of patients, especially women, they want to remove their oral pigmentation, but also now it's increasing. They want to remove their labial depigmentation. So I've managed to write, but of course, also you can find it in literature, a protocol with the 980 nanometer wavelength of the Lasotronics in order to remove the labial depigmentation. Some cases of crown lengthening, what are the advantages of using the laser? What are the keys in order to have a successful result? But also what are the limitations and when you need to use the laser, but also remove from the bone. Here, for example, these twins were treated. Recently, I did a crown lengthening with bone reduction. The first incision was made with the 980 nanometers, so it was made with the laser. This case, hopefully, I'm going next week or this Thursday, I'm going to share it with you in details. Lip repositioning and gingival depigmentation, for example, in this case was made. You can appreciate here the crown lengthening that was made, but also the lip repositioning, and we did a gingival depigmentation for this patient. This treatment was fully made with the laser. So I did the crown lengthening with the laser, I did the lip repositioning with the laser, and then before actually I did the gingival depigmentation, and I did 3 sessions of whitening also with the laser. So cases like that can fully be made using the laser. This is a case of vestibular deepening. We wanted to preserve here, for example, the keratinized tissue. for the implant. So there's an innovative and new approach using only the laser, but you have to suture in order to do a vestibular deepening, and therefore, in this case, to preserve the keratinized tissue, therefore preserve the health of the implant. Also, how to use the laser for the biofilm-induced gingival hyperplasia. So severe cases like that, you need to use the laser in addition to your non-surgical treatment of the gingivitis, because the hyperplasia can persist. So also, I'm going to share with you the protocol step by step. Usually, these patients are orthodontic patients with bad oral hygiene, and also patients with some specific medication. They take some specific medication, for example, for epilepsy and others. So things like that also we're going to see in details. How to do a frenectomy. And a frenectomy with the laser is very interesting. Relatively easy, but there is a lot of relapse. I see that we have a lot of relapse when we use the laser. Why? Because there is a special things that we have to take care of, and usually practitioners do not take care of. So also in details, I'm going to talk about the frenectomy. What are the keys in order to have a successful frenectomy? Because sometimes after 3 weeks, if you see the patient again after frenectomy, you will find that there is a new frenum. Maybe this frenum is also stronger than that of before, and actually your treatment wasn't efficient. We're going to talk about now, as I've said also, in Thursday in the section dedicated for the periodontology, we're going to talk about how to increase your disinfection when you are treating patients with periodontitis. Now, of course, you don't want to increase the disinfection for all the patients. When you have a controllable periodontitis, maybe you don't need to use any additional approaches, not even antibiotics or antimicrobial peptides, probiotics. But in some cases, as you all know, we have a persistency of this periodontal pocket. So even after treatment, you will still have a persistency of a periodontal pocket. In these cases, usually according to Linde, if you remember his classical paper in periodontology, the probing pocket depth, he said that pockets that are greater than 5 millimeters needs to be treated surgically. So today, this was written maybe 50 years ago. Today, what we are trying to say is that, okay, for these patients with pockets that are greater than 5 millimeters after treatment, they have good oral hygiene, good control of the bleeding. Why not try to do additional approaches, such as using the laser to very significantly increase the disinfection and avoid telling the patient that we need to do a surgical intervention, and therefore avoid a huge or a severe recession. So this is the concept. Using the laser in periodontitis is extremely efficient, but in some cases, when you have a remained pocket, when you need to do additional approaches, and there's no need actually to do it for all patients and all kinds of treatment. So yes, in some cases, and I'm going to share with you, you can have a bone regeneration, such as here, for example, if you compare baseline and after 1 year, only by using the laser. There's a special protocol. Today, it is very well, it's very well approved, and it's very well, it's very scientifically evident. So I'm going to share with you this protocol, but of course there's some limitations of this protocol, and there's some conditions. You have to, for instance, I'll give you an example. You have to have a 3 walls defect. So only 1 wall is defected and there is 3 walls. And in this case, you can do this this periodontal regeneration without actually the need to put a membrane and to do a surgical intervention. And also, we have protocols, and here specifically for the lasotronics, known as the photodynamic therapy or photoactivated disinfection. So you can increase the disinfection using special photosensitizer that were very carefully made by the lasotronics. And I will show you with a PCR test the results. So usually this photosensitizer is the toluene chloride. Okay, it is a very strong and unique photosensitizer developed especially by Lasotronics, and they have that pattern of it. I've did some, actually I did it for my PhD. I've did some PCR tests for the periodontal pathogens using this toluene chloride. Okay, I did it for almost 10 patients. So before treatment, before surgical and any scaling root planning, I will do the PCR test. And then immediately after treatment, I will do the PCR test to see. And the PCR test, the real-time polymerase chain reaction, is made only for the periodontal pathogens. So for the red complex, Porphyromanus gingivalis, today it is known as being the keystone pathogen. For Aggregatibacter actinomycetam comitant, Privotella intermedia, and etc. I will share with you one patient because this study is not published yet, but I just want you to appreciate really the huge disinfection, the very significant disinfection that you will have after using toluene chloride, the photosensitizer by the Lasotronics, coupled with the 635 nanometer wavelength. Okay, so this is before treatment. You can see, okay, it's in Polish, but it's not very hard to translate. I'm going to help you. TBC is the total bacterial count. So we had 1.3 multiplied by 10 times 11, so 10 by 11 total bacterial count. This is the number of bacteria that I saw in my PCR test before treatment. You can see, okay, it's fine for this patient. He didn't have Aggregatibacter actinomycetam comitant, but he had Porphyromanus gingivalis, the keystone pathogen for the periodontitis. It's like chef d'orchestra. We had Tannerella forsythia, and we had Peptostreptomicros. Immediately after treatment, there was a significant reduction of the total bacterial count from 1.3 multiplied by 10 by 11 to 4.1 multiplied by 10 by 9. There was a total absence of Porphyromanus gingivalis, of Tannerella forsythia, and of Peptostreptomicros. So as a result, we had a very significant disinfection. Now, in my study that hopefully I'm going to publish, I compared the results obtained with the PCR with the photosensitizer. These results were compared with without the photosensitizer, using only the non-surgical treatment consisting of scaling root planning. There's other approaches. You can use also the 980 nanometer wavelength of the Lasotronics without the photosensitizer inside the pocket. You have this advantage since you have two wavelengths, and you can use it also with sodium hypochlorite. This study was recently published. It needs, I think, 10 days maximum to be available on PubMed. Also, I did a PCR test to see how the 980 nanometer wavelength is interacting with the periodontal pathogens. So let's talk a little bit, for those of you who are new, why do you think that you need the SmartM laser? First of all, and hopefully when we start the clinical cases, you will understand this, the SmartM laser presents 3 wavelength. So when you have a 3 wavelength, this means that you have 3 lasers. The 980 nanometer wavelength is made specifically for certain indications, to do a surgery, a microsurgery, a decontamination, a disinfection in the root canal, etc. So this wavelength is the perfect wavelength for this kind of surgery. But also you have another wavelength that was proven to be perfect for the low-level laser therapy, stimulation, photobiomodulation, photoactivated disinfection, and etc. for the pain management. So usually, and I think I have some slides to talk about this, usually each wavelength is made specifically for something. So when you have a laser that has a 3 wavelength, this means that you are doing in a correct way all the clinical cases. Okay. The second reason is that this machine is supported by medical literature. There is always studies that are being published with the smart arm laser. There is always improvement. Okay, they criticize, for example, their parameters, and then they improve their parameters. There's studies to prove that, for example, for gingival depigmentation, this is the correct protocol, this is the correct wavelength. There is a lot of accessories in this machine. So for each application, you will have the specific accessory that you will need. For instance, I'm going to show you later. For the whitening, for example, you have an applicator that you can apply. For the low-level laser therapy, photobiomodulation, you will have a special tip to be used. All the parameters are already preset. So for the beginners, they just have to press, for example, for, let's say, for the management of pain, they just have to press and the parameters are already there. And with time, when you are an expert, you have the possibility to make your own parameters, to change your parameters, and to save them. Okay, so these are some of the advantages. Now, of course, for things that are very technical, you need to ask your distributor or the people that are specialists in this. Okay, I said also that with the smart laser, you can work in a super pulse mode. The advantage, I will say it only in one slide. For example, here, I'm working in a continuous mode. I have a very efficient cut, so the absorption is perfect, the cut is perfect, but I have a lot of generation of heat. With the super pulse mode, you have the option to work with a very efficient cut. So you can see here that the cut is very efficient, but also the heating is significantly decreased. Okay, why this? Because in a super pulse mode, you have the laser that is active for nanoseconds, and then the laser is giving time for the tissue to relax for nanoseconds. So the peak power will be conserved, peak power, so the efficiency of the cut will be conserved, but also we do not have a lot of generation of the heat. So these are, of course, as I've said, some of the advantages. You can discuss to understand all the advantages with the specific people, but this is why personally I've chosen the Lasertronics for these reasons, and then with the clinical cases you will understand more. So here I will just give you a quick example. This is working with exactly the same parameters. So this case and this case, we have exactly the same parameters. Here I'm working in a continuous mode. So you can see that I have a very important cut, okay? It's very deep, but also I have this black halo, and this black halo is the carbonization, okay? So I want you now to compare it with a pulsed mode, but this is working in a pulsed mode. You can see that the cut is not as deep as working in a continuous mode, but we do not have this black halo, okay? So there was no generation of heat, no carbonization. That is very important. So don't get me wrong, in some cases you have to work in a continuous mode, but in other cases you have to work in a pulse mode. And you have these two options. So for example, if I want to remove a vascular lesion, I want to remove an hemangioma, I will work for sure in a continuous mode because I want this heating to stop the blood inside the lesion. But in other cases, when I'm working near the alveolar nerve, for instance, on a wisdom tooth, I want to protect the lingual nerve. In this case, I have to work in a pulse mode. I will preserve my efficiency, but I will not generate a lot of heat. So really, you have to choose when and in which case you have to work continuous or pulse mode. As I've said, there's many accessories. Here, for example, you can see the accessories for the surgical interventions. For periodontology, we have these 3 tips. For the photobiomodulation, the stimulation, we have these tips. Okay, you can change them according to your targeted tissue. For the whitening, you have this big applicator. And here also for the whitening, for the photobiomodulation, you will have these tips. And also, I think it's missing in this picture, we have some tips for the photoactivated disinfection. Now, as I've said, and again, for those of you who are new or who are not familiar, this is the Smart M Pro laser. This wavelength is only made for the diagnosis, so you can really appreciate how you can have a good diagnosis using this wavelength. One tip that I can give you, it is very important to turn off the lights of the clinic when you want to use this wavelength to really have the best experience. You, the patient, and maybe the assistant, you can appreciate everything, for example, that is calculus, biofilm, will be highlighted with this wavelength. All the crowns will be highlighted. All the defectuous lesions, restorations will be highlighted. If you have a vascular lesion on the tongue, this also will be highlighted, and the pigmentation. So you can really do a perfect diagnosis with this wavelength. There is also the 635 nanometer wavelength dedicated for the photobiomodulation. This is the scientific term, but to understand it, it's like stimulating, modulating, attenuating the pain, the inflammation, post-extraction, after a nerve damage, also for the disinfection and for the decontamination. This wavelength, according to many associations, I can give you an example. The Multinational Association of Supportive Care and Cancer and the International Society of Oral Oncology, they recommend that if you want properly to do a photobiomodulation, if you want properly to stimulate, it is better to use wavelengths between 600 and 700 nanometers. So here you have the perfect wavelength. You have the 635 nanometer wavelength. And then you have the wavelength that is dedicated on your right for the surgery, for the ablation, for the removal of lesions, to do microsurgery and macrosurgery, also to stop the bleeding, to do a decontamination and disinfection. So this is the third wavelength that you will have in the smart laser. Now, a little bit, just a few words of laser tissue interaction, and I think this will help you so much. Whenever the laser and whatever is the wavelength, whatever the laser that you are using, whenever the laser touches your tissue, only these four reactions will happen. Some of the energy will be absorbed, and this is the energy absorbed. So this is, if you want to do an incision, this is how you will do an incision. So we say that the absorption is clinically significant. You have to use it. Some of the energy will be transmitted. This is also clinically significant. For instance, if you want to stimulate in depth, so you have to understand the energy transmitted. Some of the energy will be reflected, and this is clinically not significant. This is just a waste of energy. This is why you have to wear protective glasses. Some of the energy will be scattered, and this is also a default, natural default. The energy will, this energy will not be absorbed. It will go into depth without doing anything. So the total of your output power of your output energy will be divided into energy absorbed, transmitted. These two are clinically significant, and energy reflected and scattered. Why am I saying this? Because if you have to, when you want to use the laser, this is why it's very important to choose the correct wavelength, so it will be absorbed differently. And this is why you have to understand what is the constitution of your tissue. So I want to work on a pink gingiva. It is different than I want to work on a gingiva that is very inflamed. So it is rich in water, and also it's rich in hemoglobin. So the interaction will be different. So 980 nanometer wavelength is, between the brackets, a perfect wavelength for absorption. So a perfect wavelength for surgery. So this is why it was chosen. Effective to cut. Usually this effectiveness will depend on your targeted tissue, so the constitution of the tissue. The 980 nanometer wavelength is more significantly better than the 635 nanometer wavelength. And here you have to understand that if someone is using a laser with the 635 nanometer wavelength to cut, okay, let's imagine a machine that is like that. it's not that he will not be able to cut. Maybe he will be able to cut, but this wavelength is not made to cut. So the absorption is low, and he will need a lot of heat, a lot of power in order to cut. So maybe with 2 watt, 980 nanometer wavelength, you will cut very easily, but with 2 watt, 635 nanometer wavelength, you will not be able to cut. So you have to increase the power to 6-7 watt in order to cut something very small. And to have an efficient cut, you have to work 3-4 times on the same area. So at the end of the surgery, you will cut with this wavelength, but the problem is that you generated so much heat, you will have a risk of necrosis. This is why the 810 nanometer wavelength is not perfect for the cutting. The perfect wavelength, if we are talking about the diode lasers, is the 980 nanometer wavelength. And this is why with the smart M laser, only the 980 nanometer wavelength is used in order to do a surgery. And they have another wavelength that is the 635 nanometer wavelength to do the stimulation. Why? Because the absorption is not important with the 635 nanometer wavelength. So the energy will be transmitted into the depth. And this is exactly what you want with the 635 nanometer wavelength. So this is why you have to have specific wavelengths for specific indications. I hope now it is clear for you. And this is why personally I've chosen the Lasertronics laser, because I have each wavelength that is dedicated for each application. But then again, you have to understand this. So this is why educational programs is very important for you to understand the advantages that you have between your hands. So as I've said, the 980 nanometer wavelength is better in absorption for us. Okay, it's better in the surgical interventions. So this is why it is used for the surgery. And of course, the parameters will change the clinical efficiency. So 980 nanometer wavelength is good for the surgery. Working with it 7 watt, you will have better cut than 980 nanometer with 0.5 watt. That's logical. And again, this is why it's very important to understand, to attend some educational program, because you need to understand how the parameters will affect your practice. Okay, you need to understand things if you want to have perfect results. Now, I've said a lot of things about this slide when I was talking on the previous slide. Here, the transmission is more important with the 635 nanometer wavelength, and this is why this wavelength was chosen for the photobiomodulation, for the low-level laser therapy. And I've said based on many important associations, such as the Multinational Association of Supportive Cancer Care and others, they recommend this wavelength for the stimulation. So you are safe to use this wavelength for the stimulation and not in order to do a surgery. It is perfect for the disinfection, for the stimulation, and to control the inflammation. Again, the parameters are very important, especially when it comes to the photobiomodulation. If you have the correct parameters, you will have a clinical result. Okay. I will give also the last slide about the laser tissue interaction. You can see here the 980 nanometer wavelength of the Lasertronics. Okay, so it is absorbed by water. So if you have, and it's not that if you have the oral cavity, 60% of the oral cavity is actually made of water. So you have a perfect absorption in the soft tissue. It is absorbed by the red color or the hemoglobin. So this is why you have a perfect absorption with this wavelength in your soft tissue. The tongue, the gingiva, the mucosa, all of them consist of water and present a high percentage of hemoglobin. And it is very well absorbed by melanin. So it is very well absorbed by the pigmentation. And now you can understand why it gave the best results in gingival depigmentation when you compare it to CO2, for example, or the erbium. So this is how you start. You have to start to think. The 635 nanometer wavelength is somewhere here. It's not very well absorbed, and this is why it is perfect for the stimulation, for the photoactivated disinfection, for the low-level laser therapy, for the photobiomodulation. So again, why smart AM laser from the Lasertronics? Because it has the perfect balance between 980 nanometer that is perfect for absorption, and to increase the absorption, to increase the efficiency, you have special tips that can be used, a very thin 200 micron tip for the surgery, etc. And you have the 635 nanometer wavelength for the photobiomodulation, low-level laser therapy, photoactivated disinfection, and etc. So you have this balance, and this is why objectively and scientifically, before the Lasertronics, before that they know me, I have chosen the Lasertronics, because you have in this laser machine the balance between being able to do a surgery correctly with the correct wavelength and being able to stimulate. Okay, so let's go back now to our educational training program. Now, in October 27, it is going to be dedicated for the low-level laser therapy for the photobiomodulation. The first session, as I've said, will be for the periodontology and implantology. In this session, October 27, the second one will be about the photobiomodulation, how we can use it in and for the temporomandibular joint disorder, inflammation of the muscles, how can it be an adjunctional treatment. Also, I've published a case. You can find it on PubMed. It's free of access. How you can use it post surgical damage of nerve. So it was a case. It was a patient that was referred, and there was a traumatic accident, and the nerve was damaged. And according to the patient, it was irreversible because he waited for more than 3 months. And then I've started some sessions of photobiomodulation, for sure, based on scientific evidence, and he had an improvement of more than 90%. The third section, we're going to talk about the management of dentinal hypersensitivity with the laser, with the 635 nanometer wavelength, a definitive treatment, a treatment that will last for a very long time. The problem in dentinal hypersensitivity is that treatments are usually temporary, but with the laser, you can have a treatment that can last for a long time. I'm going for sure to share with you the protocol. And we will talk about the photobiomodulation in cancer patients. And here I've published many articles, and it was an area that is very interesting for me. Why? Because as you can see, if you read the literature, until today, there is no other approaches that are efficient when it comes to the oral complications that the cancer patients have. And I can tell you from now that 80% of patients that will undergo chemotherapy will have a severe oral mucositis, a severe inflammation of the oral mucosa, and there is no treatments today. So the photobiomodulation is very promising, and this is why it was very interesting for me, and I've published many studies about this. Then we're going to talk about the treatment of the osteonecrosis of the jaw. For sure, it depends on the severity. We will talk about the immediate pain relief using the laser for any kind of situation you will have in your clinic. And finally, some protocols in order to have a gingival papilla regeneration. Okay, now, I don't know, for the person who drew a little bit on the slide, if he can erase all of them. So now, just a quick notions about the photobiomodulation. For those of you who are not familiar with photobiomodulation, photobiomodulation is the stimulation or the modulation of the living tissue. Microscopically, in a biological point of view, it was shown by for many years now, it was shown that the photobiomodulation, a certain parameters of light of laser can stimulate the cytochrome C oxidase that is inside the mitochondria, and by this we will have a stimulation of the ATP production. Having a stimulation of the ATP production, you know that the ATP is the energy of the living tissue, so stimulating the ATP production will stimulate the tissue that you are trying to stimulate, your targeted tissue. And also it was found recently that photobiomodulation can cause a short and reversible burst of reactive oxygen species. This is very important in order to control the inflammatory process. So this is microscopically how photobiomodulation works. Now, macroscopically, for us in the clinic as clinicians, what is important for us is that photobiomodulation, and in any case you want, can reduce the inflammatory process. So whenever you want to reduce the inflammatory process, you can use the photobiomodulation, the 635 nanometer wavelength. Photobiomodulation enhances the tissue repair, it increases the wound healing and the tissue regeneration, and decrease pain. Okay, so these, from now you can understand that these are the indications of the photobiomodulation, and this is where you can use it. The problem now with the photobiomodulation is that it is very sensitive. So if you really want to have a positive result, you have to follow very carefully the parameters and the protocol that were already used for this kind of treatment. So let's say for the management of oral mucositis, for the management of the inflammation of the mucosa, if they've said that you need 4 joule per centimeter cube, it's not enough for you to do 4 joule per centimeter cube. You have to understand these 4 joule per centimeter cube, how were they delivered? So for example, you have to understand the power, the time of irradiation. Was it in a continuous mode or not in a continuous mode? Was it in a contact mode, not in a contact mode? So all of this must be very well understood if you wish to have a positive result. Also, you have to make optimal calculations for the energy density, as I've said. So it's not only about the energy density, it's about the calculations. How will you have this energy density? Everything depends, as I've said, on the constitution of your tissue and the state of your tissue, if it is an inflamed site or a healthy site. So this is why my advice for you, when you want to do a photobiomodulation, you can do it even if you are not that expert. You don't have time to read all the articles, but my advice to you is to follow exactly the protocol that you find in literature. So you will take an article, you want to do exactly the same protocol, you have to follow all the parameters, okay? Not only the energy density. So as I've said, when it comes to the management of cancer patients, I'm not managing the cancer patients. I'm managing the complications that will come from the cancer treatment. Photobiomodulation was proven to be very effective in the management of the inflammation of the oral mucosa, known as oral mucositis. And as I've said, it is very frequent. It is known to be effective for the management of dysphagia or a contradiction. Okay.
Thank you, Dr. Marwan.
I have one question because I am really confused with the next sessions. The session today was the first out of 4, and it was 17th of October.
Right.
So I am confused if the next session would be in 4 days and following what is written on the slide, or when exactly are the next sessions, because we are already 17th and we have 3 sessions ahead.
Let me respond to your question, Mr. Marcin. So session 1 will start 20th of October at 10 a.m. Polish time. The session 2 is 27th of October at 10 a.m. And session 3, this is 3rd of November.
Exactly, yeah.
Yeah. So we have. So no questions, basically, Dr.
So my last comment, according to my understanding, this was very introduction session with 3 very interesting topics ahead, which would be more deep and more advanced with some precise protocols and explanation divided on a few different wavelengths and to a few different topics for the next sessions. So it's nice to hear, let's say, more advanced presentations after that first introductory. And thank you, Doctor, for that.
Thank you, Mr. Martin. Yeah, for sure, it was an introduction to say why it is important to have 3 wavelengths and why it's important to have a laser. And then in the sessions that we will have ahead, we will start in details to talk about each field in dentistry. So the first one will be about everything related to periodontology and implantology. The second one will be related to the photobiomodulation in all fields of dentistry. And the third will be about aesthetic medicine, aesthetic dentistry, root canal treatment, endodontics, and also our daily practice. And we will go in deep in each one of them and each specific field about the parameters, the exact protocols, the current evidence, and also the limitations.
Yeah. Dr. Marwan, we have one good question from Miss Jurgita. She's from Lithuania.
Okay.
She is asking, it's actually a simple question. Why should doctor purchase our laser, right? Yeah. So what is comparing to regular treatment without the laser? So what can you say? Like in general, in shortly, why they should buy Smart M laser? In general, the laser.
Okay, I will divide the response in general also into 2. First of all, why lasers? Because you will improve very significantly your practice in many cases. And I will quickly say, for example, a crown lengthening, frenectomy, a treatment of all the periodontitis, a treatment of severe gingival hyperplasia in order to stimulate post-extraction if you have any pain. All of these can be managed very significantly better with the laser. And why the smart laser? Because with this laser machine, you have 3 wavelengths. So you will have the correct parameters, the correct protocol in order to have this positive result. One reason. The second reason is that you have many accessories that will allow you to do your protocol in a correct way. And for all the other reasons that that you know more than me, for example, the investment, it's a good investment, how they can let the patient, how they can return their investment, the pricing, and etc. Okay.
Yeah.
Okay, how this laser could help the doctor earn more than before without using laser. For me, for example, I have a lot of referred patients for a gingival depigmentation. Maybe you don't have this a lot in Europe, but I have a lot of referred patients for gingival depigmentation just because I know how to do it with the laser in a proper way. And there is actually a result that can stay for more than 5 and 6 years. There's a follow-up of 5 and 6 years. A lot of patients are referred for oral complications related to cancer patients, for crown lengthening without using conventional approaches. Patients for the management of periodontitis are referred to me in order to do a proper disinfection, decontamination. Peri-implantitis patients are the patients that everyone don't want to deal with, because what is the solution? You have to remove all the implant from the bone. So also these kind of patients are being referred for the whitening and for the everyday practice.
Thank you very much, Dr. Marwan.
And also, yeah, please read the comment in the chat.
Yeah, we have also one opinion from Mr. Martin. Laser is supportive device for many applications. Doctor is saving time, 1 visit of patient instead of few more patients are taking at the same time. Yeah. Yeah. So, is there anything to add, Dr. Marwan?
No, I just hope to see you there. And of course, we've answered quickly some of the questions about the advantages, but as simply they can just see in each field in dentistry how we use the laser, and I think they will have their response for sure.
Yeah.
In details, yeah. And there's many publications about using the laser in dentistry, so also they can read, they can understand more this field and how they can improve their practice.
Okay, good. Thank you very much, Dr. Marwan. I thank everybody, and I really hope that you will use the great chance and opportunity to attend on the main sessions of our extensive online dental training. So see you next time on 20th of October at 10 a.m. Polish time. Thank you very much, everybody. See you next time.
Thank you, everyone. Thank you.
Thank you very much, Dr. Marwan.
Thank you.
Thank you. Thank you.
Thank you.